Yeah.
I don't know if you had a chance, but we just put up a no pink ribbon sign on our website, the Medical Conspiracy. We put a sign with an explanation on our stand. Yeah, you want to laugh about things, you know. But the important thing is that you're back home, you are living a normal life, you're working, you feel great.
Yeah, I feel great. I feel awesome. And then, you know, I think when it's all said and done in the big picture, don't we all want quality of life and not quantity of life? You want quality.
Yeah.
So if we're all going to live like, let's say we had to make a choice, I think most of us, we would pick quality over quantity. So you want to feel good every day, right?
Yeah, but this does not shorten the life either. So
no,
medication do so. So it's not that you are giving up a longer life for a good life. No, you're not giving up anything. You're just giving up the fear.
You're going to have both.
You are giving up. Yes.
The quality and long life.
The quantity. Yeah, and all you have to do is give up the fear. That's really
what
you need to do.
And the fear is just around us everywhere. We open up the newspapers. We listen to the news. We look in magazines. It's all the fear. We're being brainwashed, bit by bit.
Yeah, we are.
Sure we are.
Well,
Go ahead. Go ahead.
No, you go ahead, and then I'll ask you something.
And they want to keep us that way. They want to keep us fearful, because the more fearful we are, the more they can control us, the more we're going to do it, you know, their way. And their way is, hey, it's for somebody's pocket, right?
Yeah, absolutely.
It's all about the money, isn't it? About money. It's all about
It must
power.
be, because everything is so expensive.
And
they're only happy. And they seem to be only happy and give up bothering you when you agree to have these drugs for life.
That's right.
You're on a setting forever, or whatever else they're using forever.
So
it just, it's awful. But listen, one thing they were saying was breast cancer is a horrible disease. Can I have your opinion on that?
It's a horrible disease?
That's what they're saying, you know, the Common Foundation and all the group. Breast cancer is a horrible disease. Can I have your view on that one?
I think it's only what they have made it to be, because breast cancer in itself, I don't think it's so terrible. I think that's something that a woman can live with. The fear is what we read and what we hear and what's being done with it. And the surgery, it becomes horrible, because they want to take out lymph nodes, and they want to... we got a break coming up. We're going to finish up after the break, okay? All right. All right, we are back from the break again, and Francesca is still with us, and we want to hear the conclusion of the story to this point, and then we'll continue keeping in touch with her. Okay. Okay.
You there?
Hello.
Yes.
We're back. The conclusion, I guess, what I would say to all women out there, do your research. If you find out, if you find out for any reason at all that you have a slight lump, I would recommend go for ultrasound. Don't go for mammograms. Go for an ultrasound. I would not have a biopsy myself again if I had to go through that, because they do say it spreads cancer, and I've heard that over and over again. And do your research on natural healing. There's lots and lots of information in the libraries, tons of books, and there's a lot of alternative, really good alternative people along the way that can help us with the healing process. And in my case, and this is not for everybody else, and I did become a vegan, and I do believe it has really helped my healing with the cancer, and it will help me all along. And so I guess that's what I would recommend, and just keep reading the books, and get yourself informed, and get yourself empowered. Get yourself empowered as a woman, so you are in control of your own body. And to me, the worst thing that could happen to me as a woman is to have half of a breast or a breast removed. I would just, every day I would look in the mirror and I would just feel terrible. So for me, it was worth it, doing whatever I would have to do, and still so, to stay whole. And I think by staying whole, go ahead.
Yeah.
Go ahead.
No, I was just saying, I think all women feel that way, that they don't want to miss a part of their body.
Absolutely not.
But the thing is that they convince them that unless they do that, they're not going to survive. That's the real problem. Okay?
That's right. And
they tell them.
And they've proven over again, Dr. Anello, and you would agree with me that with cancer, you can live a long time with cancer. Don't you agree?
Even if you don't do anything. Yeah, absolutely. Right. Even if you do nothing.
Absolutely.
You live longer. You live a lot longer doing nothing than you would doing all these things.
Absolutely.
So even if you don't want to go and do anything at all, you're still better off.
Absolutely. So. And that's what I found in all my research. Whatever you do, this is still a better way to go. And it's like I said, I would not have had the energy if I had not gone the holistic way. And there is a way. And I think people get afraid because they don't know which way to go. They don't know where to turn. But I think if you go to the library and start reading on alternative, there's lots and lots of information out there. And if anybody wants
we're not going to be in the library, but...
What's that?
Our information is not going to be in the library, but at least they start. Because what happens is you go to alternative and you do certain things that at least slows down the growth. And that gives you more time to find out what to do to totally kill that nuisance.
Right.
Because really... You know, you said, I like that phrase, now it's cancer turn to die.
Yes. It's great.
It is about time, don't you think?
It is, absolutely. I'm so happy to see that after a year and a half. Mind you, they say by the time we discover it, it's been in your body for 5 or 10 years.
Yeah.
It's been in your body for a long time. But, yeah, you're right. It's been there riding with us long enough, so it's time for it to go. Goodbye. You can go now.
Yeah, we don't need it.
We don't need you anymore.
Yeah. So, and then you just go back to normal life. But we will keep in touch with you so people know what happens. When you are done with the treatment, everything is dormant, so you realize that it's dead beside the ultrasound that show it is. But then you get the immune response because the body's trying to flush out the dead tissue, and that's when people panic. So we're going to go over all of that whenever that starts for you, because that depends on the person. There are no rules, okay? There are some standard rules of how many weeks it takes for the first immune response, but that depends on the person, the age, the diet, and all sorts of things, other medical problems they might or might not have. There are really, humans are individuals. You cannot set a rule that works for everybody. So
right.
We'll see, but I know you're going to be able to work and have no problem. And then we'll check with you when the immune response starts. Then we can have you appear with your experience and people know what to expect all the way through and see how you progress, okay? In the meantime, have a great life.
You too.
Have a good time.
Thank you. Thank you. Bye, Dr. Carpenter. Nice
Bye.
to meet you.
And thank you for being here. Thanks. Bye.
Thank you. It's a pleasure. Bye-bye.
Bye. Okay, so you have heard from somebody that just left. Now, all the people that are attacking and criticizing us on the web, they say, oh, well, that's because they just finished the treatment and they have been brainwashed. And that's why they're saying that. But let me ask you something. If you go for standard treatment like surgery, after surgery you don't feel good at all. And then you have the chemo, and then you might have the radiation, or you might have chemo first and then surgery and then radiation, or radiation first. Who knows? It changes. That's how they tell you you have different choices. But the thing is that throughout the entire experience, you are never feeling good. You're never feeling relieved. You have never a moment that you can forget you have cancer. Never. It's always with you. With this way, you realize that it's nothing. You are doing fine. You don't have any problems. The problem comes around when you go back home and you have all these people that look at you and say, but you still, if it's visible, that you still have the cancer, you're still visible. If it's skin cancer, you still have a lump, so obviously you're not okay. And that's really the misjudgment that people are pushing to follow. they seem to think that if they have surgery, the cancer has been removed, the lump is disappeared, no longer have cancer. Yeah, they might have some floaters, but no longer have cancer. Well, and so that's why they agree to be poisoned or radiated with ionizing radiation and all of that. No, it's not gone. Actually, you're worse off after removing the lump than you were before. Because by removing it, there is bleeding involved, and then they remove the lymph nodes, so you have an entire system. First of all, in any surgery, your entire system is totally messed up. And the more they take out, the worse. Because they don't take up just a lump, they take up the clean margin. All the bleeding causes the cancer to spread because it is transported by the blood. So, and even in this article on life extension, and by the way, the title of this article is Women Fighting for Their Lives and the Doctor That Helped Them. Yeah, sure. But even here they say that stage 4 tumor, a malignant tumor of any size that has spread via the blood to the bone or vital organs. Means the blood transported, and that's how you can get bone cancer and internal organ cancer. And usually it is, they say, it's usually liver and lungs. Okay, lung cancer in most cases is caused by radiation therapy. Ionizing radiation, you cannot stop it. You cannot be selective. You cannot be specific to the area. Ionizing radiation goes on forever. I told you that before. Unless you're a cyborg with a chest wall the size of 2 feet of lead. Most people do not have that. So you cannot stop the radiation. So you develop lung cancer and then you develop liver cancer for 2 reasons. The blood, but also because the chemo damages the liver. That's how you can get liver cancer. So all of these things cause the situation to be worse and you feel terribly sick. This is a condition where you're feeling great. Yeah, you go back, you have a normal life, you don't feel anything. Yes, the tumor is there, but it's no longer active. Like you have an electronic system, there is a component that malfunction, you bypass it. You bypass it, doesn't affect the functioning of anything, and everything is okay. Well, that's the same thing here. You bypass it by killing it, so it's no longer live tissue, it's no longer active, and you are back to normal. Now, you last for quite a while. Now, of course, depending on what you did before, depending what is happening to you, depending on where your level of health is and what other problem you might or might not have, then that process and also at what stage you came for our treatment, it makes a difference. What happens after makes a difference in the healing process. And also the difference is what stupid thing you do after. Because if you follow post-treatment guideline, you're fine. If you go and do other things, you might be in serious trouble. But there is nothing we can do about that because we're not controlling what you decide to do. It is your life and you can decide what you want. Just don't turn around and say that it was what we did that caused the problem. Okay, we got another break coming up and then we're going to continue with